Welcome to the Always Real Talks nonprofit segment, where we highlight those people and nonprofits making a difference in the lives of our communities. Today, we have in the studio with us Stacey Stewart. She is the president and CEO of the March of Dimes. She is responsible for leading the 80-year-old organization in the fight for all moms and babies. Stewart came from the United Way Worldwide, where she served as the U.S. president of United Way, which is the nation's largest nonprofit organization. Here in the studio to discuss new incentives and programs geared towards what? Moms and babies, my good friend, Stacey Stewart. Stacey, welcome.
Kwame, it's so great to be with you.
Oh man, thanks for coming in to
Absolutely.
the studio. Just been following the work that you've been doing, not just at the March of Dimes, but going all the way back to Fannie Mae.
Yes.
Charitable giving.
Yes.
And
yes.
you know, just the work you were doing on the charitable side,
Yeah.
helping all these organizations. And
Exactly.
then, of course, to my good place. I really like this place, the United Way.
Yes, yes.
See, everyone knows about
Everybody
the
knows
United
United
Way. You know, my mother knew about United Way. United Way, United Way. You get money, make sure you donate to United Way.
That's right.
See, I remember, and
Yes.
worldwide, by the way.
Yeah.
And
now I have a different message.
Now you have a different message, which is
right.
still in the helping
Yes.
business, though.
Absolutely.
I mean, and focused, but in the help of business. Tell me
Absolutely.
about the March of Dimes.
Yeah.
And you've been there for how long now?
It's been 3 years, and it's been great. I came here really to make sure that this organization can remain strong and vibrant to help all moms and all babies. I mean, that is something I'm really passionate about. I'm a mom, you're a dad. We're just talking about that.
Absolutely.
You know, we all have moms.
Yes.
And
those that are still
those
living.
Of us,
yeah.
Yes, we've had them, or we have them. You know, this is an important cause, and the March of Dimes is such an important organization. We were started in 1938. A lot of people know the March of Dimes because of our history.
Right.
You know, we got started by addressing another pandemic.
Yeah.
At the time, polio. In 1938, we got started, founded by President Roosevelt, and we were the organization really set up to collect the funds, amass the funds that were needed to actually fund the research that actually discovered the polio vaccine and funded the work by Jonas Salk and many other researchers. So it's really an honor to lead an organization. By the way, I'm the first African American to lead this organization in over 80 years. And it's an honor to lead an organization, one started by a former president, but around such an important issue then. And it's also an honor to lead an organization where we can honestly say we actually took on a major public health crisis and solved it. Solved it in the U.S.
And that's exactly what I was going. That's the
Yes.
segment I was going to go right into.
Exactly.
And not only that, tell us about it, because a lot of people
Yes.
may not. You know, some people have been following it, right?
Yes.
But some people may not have been.
Yes.
Tell us about that.
Yeah. So, you know, the work of the March of Dimes has really been, after the polio crisis hit, we really moved into other areas affecting the health of babies especially. So looking at the issues around birth defects. And then a couple decades ago, we started to look at the issue of premature birth, which is really an issue that a lot of people really don't understand as well. But it is the leading cause. Premature birth and all the consequences of premature birth are the leading causes of death for children between the ages of 0 and 5. And so while we look at a lot of challenges that kids and babies face, whether it's around autism and cancer, very serious health challenges, a lot of people either aren't fully aware or understand that premature birth is a huge threat to the health of all newborn babies. About 1 in 10 babies are born prematurely in this country. And again, the leading cause of death for children between the ages of 0 and 5. But even if babies don't die because of being born too soon, too sick and too soon, they often can have lifelong health challenges. And that's the work of the March of Dimes today, is looking at the health of babies and the health of moms.
So before and after.
Really, it's interesting because when you look at premature birth, if we were just to look at trying to solve it during the 9 months of pregnancy, we would still not make a big difference, because what we know is that it's the health of the mother, even before she's pregnant, the health of the woman before she's pregnant, that can be have a major impact on the health of the baby. So it's looking at the health of the woman before, during, and after, which is another big issue that we're facing as well.
So what do you see the top 3 challenges that the organization is facing?
Yes. So really there are 3 big things that we're focused on. How can we reduce the rate of premature birth across the country, affecting all communities, irrespective of income, education level? How can we address that issue? That issue is around prematurity and infant mortality because the two are very tied together. But also, how can we make a difference in improving outcomes for moms in the postpartum phase? So addressing issues of maternal mortality and morbidity, women that die as a result of pregnancy and childbirth or almost die as a result of pregnancy and childbirth, which is also a huge issue. And then the third area is really around health equity, because what we see across both of those areas around premature birth, infant mortality, maternal health, is a huge gap in terms of health equity, major disparities, especially among women of color, especially among African American women. So how can we make sure that while we look at those two big issues, that we pay a special focus and special attention to those women of color, and especially African American women as well?
And on the second point you made, in terms of mothers that are that lose their life during birth.
Yes.
Has that gone up? Has that gone down over the last 10, 15 years? Are we doing better? I mean, where are we?
So Kwame, this is what's really so amazing, and a lot of people really are shocked when they hear this. Right now, the U.S. is considered the most dangerous developed nation in which to give birth. While other developed nations have seen their rates of maternal mortality and morbidity declining, ours in the U.S. have doubled over the past 25 years. And today, a black woman over the age of 30 is 4 to 5 times more likely to die because of pregnancy and childbirth than a white woman. And that is really shocking.
Say they both, come from families where they eat well, they exercise well. I mean, is it other things that contribute to that factor?
It is not tied. There's no correlation to income level or education.
It's just straight race?
It is. When you break it completely down,
it's straight race.
You can look at a woman, a black woman who is highly educated with income, access to health care, compared to an uneducated white woman with a high school degree or no more than a high school degree, and that black woman, that highly educated, high income black woman, will still have a greater chance of dying as a result of pregnancy and childbirth than that white woman. And so we know that if you take away all those other factors around income, education, access to health care, then what is left? There are serious implications around implicit bias in the healthcare system, and not racism in the system.
So it's not genetics.
So it's not genetics,
right? Because some people would think it's just genetically, right?
There's no genetic flaw that black women or women of color have that cause them to die at a higher rate. It has more to do with...
Is it the quality of health care that they receive?
It can be the quality of health care, but then the question is, why is it that so many African American women, even with access to all these personal resources, may be getting less quality care, may not be paid attention to at the same rate, may not be respected in terms of how they present with symptoms, or heard or listened to in the same way that other women are. So this is a very serious issue, and the issue of embedded racism and implicit bias in the healthcare system really is not new.
Yeah, yes, it's
not new.
But as you define it down, because one would think, right, if you just wasn't paying attention, going about your work every single day, you just think, oh man, something must be going on. Why are black women dying? Is it because they're low income, they're not eating right,
no,
they don't have access to health care?
So here's
but you're saying all things being equal, they're still are not making it.
Exactly. And I think the thing that we really try to make sure women understand is that often women feel like they're to blame for why these outcomes are the way they are. And what we're trying to say is that, sure, women, all of us need to own our own health, feel empowered to make the right decisions, be able to make good healthcare decisions for ourselves and for our family. But when we're doing that and we're still seeing worse outcomes, then the blame cannot be solely on women. We have to look at the systemic failures that exist and the things that are going on in the healthcare system that are simply just not meeting the needs of women, and especially women of color. Now, I will say that,
specifically women. I mean, clearly, it's really specifically women. It's like it's almost and by design, based on what you kind of see and read. I mean,
African American women are on the short end of the stick, so to speak. But I would say that I don't want to completely ignore the issues that Native American women are facing, Alaska Native women are facing, Hispanic women. So it's women of color, but African American women, no question.
You're just saying from a statistical point, it's clearly clearly. Now they have that. I'll tell you what. We'll be right back. When we come back, we're going to talk a little bit about the coronavirus, and we're going to talk about a new fund, a support
Yes.
fund. We want to talk about that initiative
Yes.
that you guys are spearheading because, hey, look, it's always real talk. We'll be right back.
My name is Darren Stewart. I go to Thurkin Marshall Academy.
My name is Kayla Williams, and I'm a freshman at Temple University.
The program has helped me by opening my mind to travel more.
The Challenge now in GSF has helped me just open my eyes to different cultures, gave me the opportunity to learn and speak a different language, and then experience that and then use that language in another country.
And just realizing that there are people out there who are not as fortunate as I am. And so it makes me want to help them. Just knowing that you have to always be open to new things and never judge anybody.
Welcome back. We're still here with my good friend Stacey Stewart. I mean, you gave us some excellent information on what's happening with women in general, especially women of color, as it relates to the having birth and some of the obstacles and some of the, should I say, I guess I can use the word, some sort of discrimination. It has to be something. I don't want to get into it.
Well, there's definitely implicit
there's some
bias.
differences. Okay, some bias.
And we would say racism that plays out in terms of treatment and how women get treated
in
the system, yeah.
So we have so many viewers, as you know, a large number of our viewers are women, and some of them are women of color. What 3 nuggets could we leave them with, if that they could think about if they're going through this situation, or they know someone that's going through the situation, or they just want to know before they actually have a child?
So one of the things that we want to really make sure, especially young women, understand is that just because we are seeing these outcomes doesn't mean that this happens to every woman, right? What we want to do is make sure that the truth is out there so that women are more aware of the things that they can do to protect themselves, to make sure they understand what care they should be getting, to make sure that they have the right answers to their questions, to make sure that if they're feeling dismissed, that they know how to advocate for themselves. So that's really important, because just because things are the way they are today doesn't mean that we have to stand for the way they are, and that really women can make these outcomes really improve over time. And so there are a few things I think women can do. One is that it's important that women understand their own health and really take their own health into their own hands. One of the things that we see is that often women will see worse birth outcomes because their own health is not as, they're not as strong as they can be, or is not as healthy as they can be before even getting pregnant. So we want women to be as healthy as they possibly can be even before getting pregnant, meaning keep your weight in check, eating the right things, trying to exercise, doing all the things that we know to do to try to be as healthy as possible, managing any chronic health conditions. The other thing is just, again, being more aware, knowing how to advocate for your own health, having someone, a family member or a friend there to also advocate with you if you need that help, asking the right questions, making sure that doctors and nurses and anyone who's a provider is answering those questions that you may have about your health. And that's, again, before pregnancy, during pregnancy, and again, even after pregnancy, because a lot of the issues around maternal mortality, morbidity are when women die after the baby has come. And when women are still having health challenges, but they're not able to seek the help that they need or can't receive the help that they need. I think the other thing is just being an advocate for all women, right? We at the March of Dimes are really inviting all women to join us, to have a stronger, louder collective voice for policy change, not only in DC and other local cities, but around the country. So we're very much working with the Black Maternal Health Caucus on the Hill and others. We need more voices, and there's a way to do that by going to marchofdimes.org and signing up to be an advocate.
You know, I was about to go there. You know how does one go up?
Absolutely.
Go to marchofdimes.org.
That's right.
You see it on the screen. Sign up, but more importantly, share it. Share it with others.
Absolutely.
Right? If you sign up, get others to sign up.
We're stronger and powerful together when we have a strong collective voice. So
now
we want to invite everybody to be a part of the work we're doing. Yes.
So look, everyone find 10 people.
That's
sign
right.
up, right? That's it.
At least 10.
At least 10. At your home. I know you're home because everyone's not out running around, so you're
Everybody's
home.
at
So
home.
if you're at home, go ahead and you're on your phone, because I don't know anybody that's home that's not on their phone, right?
That's right.
So you're on your phone. Go ahead and text 10 people and tell them to sign up.
That's
text them the
right.
link. I think that'd be good.
I think that's great.
Yeah, it's a good way to go. Let's see if we can get going here. So I want to go into something that's going on now. And you know, the coronavirus
Yes.
it's here. It's serious.
Yes.
It's alarming. People are nervous. Some people are panicking. Our young folks, if you're watching, stop going to the beach. Like, really take this thing serious.
Yes.
Wash your hands. 20 seconds and all that stuff.
Right.
But the March of Dimes is doing something phenomenal with your Mom and Babies Intervention
Yes.
Initiative.
Mom and
Did I say
Baby
that right?
Intervention and Support Fund.
And Support
right.
Fund.
Yes.
Tell me about that.
Yes. So when, as the coronavirus and COVID-19 pandemic has been expanding and spreading and really affecting more and more people around the world, certainly in the U.S., we decided to take some action to make sure especially that pregnant women, lactating women, and that babies are as protected as possible. There's a lot about COVID-19 we don't know. We just don't have enough evidence. It's a novel virus, which means we don't have anything that came before it to know exactly what will happen and what the outcomes will be. All we know is what the experience of what we've seen with other similar viruses, so SARS and MERS, and we're just getting a little bit of data out of places like China and the little bit that we're seeing out of other countries. It is really too early to know exactly what kind of outcomes we will see with pregnant women and with babies. But what we do know is that with other similar viruses is that pregnant women and babies can be at higher risk of getting sicker. Pregnant women often have immune systems that often don't respond as quickly to viruses and to illness as other women. And we would consider pregnant women and babies to be at risk with respect to coronavirus. So what we're saying is at the March of Dimes is we feel that we've got to do everything possible to make sure that there are a couple things going on. One, that we're working with the federal government, and we have been in touch with Secretary Azar and other federal authorities to make sure they understand that we can play a valuable role in making sure that if there's, for example, a vaccine that's been developed or being developed, that pregnant women are considered
at the forefront
in those trials. So that when the vaccine actually gets developed, it actually is safe and effective for pregnant women. So often pregnant women are thought of after the fact. We need to make sure we're thought of on the forefront. The other thing is on advocacy in general. To the extent that there are going to be funds available to support pregnant women, to the extent that our healthcare system is going to be stretched beyond its means, and we know that that's already a big challenge that we're having, we need to make sure that you can't put pregnancy and childbirth on hold. Women who are pregnant will be delivering, and we want to make sure that pregnant women aren't going to be delivering and concerned and fearful of delivering their babies in hospitals. So we want to make sure that there are the resources there in hospitals to make sure they're protected. The other thing is just making sure that there's enough education and awareness and information out to women through this coronavirus so that they know how to protect themselves. And of course, what we say to pregnant women is do what the CDC is asking all of us to do. Wash your hands.
For 20
keep
seconds.
a safe
seconds.
distance. For 20
yeah,
seconds,
20 seconds.
thoroughly.
I know some people, they, 2, 3, no, we need you to wash it for
20 seconds.
With soap. With soap.
With soap. And there's instructions. I have it on my Twitter, March of Dimes CEO, about the right instructions on how to wash your hands.
March of Dimes CEO.
March of Dimes CEO on Twitter and on Instagram. We try to make sure and follow March of Dimes generally on our social media as well, because we give a lot of information to women. If you're pregnant today, what you can do to keep yourself safe. There is no evidence that shows right now that that the virus can be spread from the mother to the fetus.
Because they had a special on that,
yes.
and I was listening to it, and they were saying that, and they was also saying that they didn't think, which is interesting, that they talk about seniors,
yes,
right, and they talk about those with compromised immune systems,
right.
But they never talk about moms.
They never talk about
those that are pregnant.
Exactly, pregnant women.
Like that's never. I mean, I don't think I've ever heard.
That's right.
Anyone mention that.
And we've got to remember that, because remember, again, if you're pregnant, you have a due date, and you will be delivering your baby, hopefully full term, hopefully on your due date. And that means that you have a date in the hospital that you have to show up. And so for those women that are already anticipating April due dates or May due dates, we want to make sure, even for the remaining part of March, we want to make sure that women know what they can do to protect themselves. We want women to know that they're safe. The healthcare system is going to do everything it can, and hospitals, to keep women safe. But we just don't want women to feel anxious or feel that they don't have the right information. So going to marchofdimes.org, contributing to our fund. This fund is going to allow us to get even more information out, be an even greater resource to more women, to more families. You know, we know even grandparents are concerned about their grandchildren who have to be delivered during this crisis as well. So
now your fund, you can do it in two ways, right? It's individuals and then there's organizations. Like
anyone
I saw it on your website.
Yes.
It says you can click one button for individuals, click one button so everyone can give.
The fund is on our website. It's at marchofdimes.org. Anybody can give to it. Obviously, companies that may really want to be a part of assisting pregnant women and
those are partners,
women,
right? That was the partners.
Many of our partners, yes. Exactly. But anyone can give. And I would just say, you know, this is a period of time at the March Times when we have a lot of major fundraising going on. A lot of people know about March for Babies.
Yeah.
This is our 50th anniversary for March for Babies. These are walks, hundreds of walks that happen around the country. Major fundraiser for the March of Dimes. March for Babies is going virtual. Next week we're going to have a virtual kickoff with Eli Manning.
That sounds fun.
It sounds fun, and we're going to have a lot of other celebrities. But there are so many. This is really a critical time. We need the public's help right now to support the March of Dimes, either through March for Babies, through this COVID-19 Mom and Baby Intervention and Support Fund. All the information is on our website at marchofdimes.org. We really want to make sure that we can be here for moms and for babies. We can't forget during this critical time that they are as much at risk as others as well. To your point around the elderly and immunocompromised individuals, we've got to make sure that pregnant women are not ignored during this time, that they have the support that they need as well.
And there's so many out there that are women that are pregnant.
Yes.
And that are having issues now as it relates to, you know, the economy.
Yes.
Right? The economy is affecting everyone. Right? And as it affects, you know, so many different people, how about those moms that are about to deliver? You know, how about those moms that's out there that need that extra?
Right.
I mean, you guys step up to the table and help in some of those areas. So if you're out there, which I know you are because you're watching me, you know, support March of Dimes. Go to marchofdimes.org. You see the website on the screen. Support the organization. Give. Right? I know people like to give to different things, different causes, but, you know, everyone. If you're here, you had a mom.
If you're here, you had a mom.
If you're here, you had a mom. So I mean, look, let's get out here. Let's try to see if you could at least go to the website and donate. Let's go donate $1 or $2, and then get 10 other people to do the same thing. Let's try to
give whatever you can.
Give whatever you can.
Absolutely.
If you can give $100, give $100. You give $1,000, give $1,000.
Right.
But give something. I think
That's
as long as we have 100% participation, you get there. Right?
I love 100% participation.
We love 100.
And A+.
And A+. Well, look, once again, thank you for coming by.
Kwame, thank you so much.
It's Stacey Stewart from March of Dimes, President, CEO, but more importantly, a good friend. Thank you for stopping by. Thank you for the nuggets.
Kwame, I love what you do. This is a great show.
Oh, no, thank you so much. If it's always real talk, you know it's going to be real.